Good afternoon, everyone. Bon après-midi, tout le monde. It's good to be with you again. I'm, of course, here with Dr. Brent Roussin, Manitoban's Chief Provincial Public Health Officer, and I'm Cameron Friesen, Minister of Health, Seniors, and Active Living. I want to first make a comment about format before we go into content. Today, I am, of course, here with Brent Roussin, and going forward, starting today, we're going to take a slightly different approach. We're going to be transferring to this once-a-week press availability live here, of course, at the Manitoba Legislature, where I, as the Health Minister, will be joined by Dr. Brent Roussin. There is, no firm rule about exactly when, to get in front of media and to get in front of Manitobans, but we've been clear that we want to be transparent. We want to provide good and timely information. We want to do our very best to keep Manitobans in the know. And many people will know that since we have been responding to COVID-19, there have been a number of iterations of how we have provided this information to Manitobans. At one point in time, of course, it was the Chief Provincial Public Health Officer with the Chief Integration Officer of Shared Health, Lynette Saragusa, who many of you now know. For a while, those were a few times a week. In the height of March, April, those were daily. Then we started to slow the pace of those, and so now we are going to do this once a week. But of course, keep in mind that the bulletins are daily, so Manitobans will continue to get those bulletins with up-to-date information. On the weekends, additional information is provided in the way of social media tweets and other information. And of course, as always, should the conditions require it, should the situation require it, we'll be doing this more often. We'll continue to follow the evidence. We believe that our approach in this way aligns with the approach of other jurisdictions as well. I'm pleased to provide you today with just a quick recap on our Phase 4, which came into effect just this past weekend. Phase 4 of our Restoring Safe Services Roadmap. It's part of our Restart Manitoba program. And we know that over 55,000 Manitobans provided feedback on this plan. That's an astounding number. And I want to thank all the Manitobans who took the time to share their comments, their viewpoints, their concerns. Some of them did it at the Engage MB website, where they took a questionnaire, completed the questionnaire. Others joined us on our telephone town hall meeting last week. And as a result of those interactions we've had with Manitobans, as a result of the way we continue to listen to the advice and expertise of public health leaders, we did make changes to that original draft document. Just a reminder of a few of the things that we have not proceeded with at this time. So right now we have not proceeded to increase indoor or outdoor gathering sizes. We have not removed the 14-day isolation requirement for travelers returning from Eastern Canada. And we have not allowed a resumption of counter service in bars, beverage rooms, brew pubs, microbreweries, and distilleries. Public health officials will review possible adjustments on a week-by-week basis, and they will make any additional changes based on the public health situation at the time. By following public health guidelines and the steps we all can take to reduce our exposure and risk of COVID-19, we can support the safe restoration of services here in Manitoba. Manitoba is in a good place and continues to be in a good place on COVID-19 relative to many places in Canada, relative to many places in the United States and globally. And we are where we are predominantly because Manitobans have done the right thing. Manitobans are listening to public health advice. Manitobans are obeying the rules. Manitobans are washing their hands. They are staying home. When they're sick, they are respecting the gathering sizes. They are maintaining social distancing. And we will continue to beat COVID-19 as we continue to work together and care for our neighbors, like our family and friends. On va continuer à lutter contre la COVID-19 si on continue à travailler ensemble et à prendre soin de nos voisins comme notre famille et nos amis. One more thing I would want to comment on before I hand the microphone to Brent, and that is that we've done well even this last weekend on continuing to test. Lab testing of COVID-19 samples is crucial and a cornerstone of our approach, and I can say that this weekend, in just a few short days, we exceeded 3,000 tests. We continue to stand up additional capacity for testing. We are aware that this week DynaCare will reach the 1,400 tests per day threshold and have plans to go beyond that. This is great news for all of us. On the other side of the coin, we need to have screening sites available. And we know that last week at points in time, there were long lineups to get to one of the screening sites, either in Winnipeg or across the province. We are addressing that. We are mindful of that. We have charged the regional health authorities to do everything necessary in order to make sure that we have robust capacity. We keep in mind that only a week or two ago, we saw a decrease in those wanting a test done. Now we're having to quickly respond to make sure there's adequate testing as that demand for testing grows. But that's all part of our efforts to get this right on COVID-19. I will offer this update and say there were plans in August to take offline the MPI drive-through site on Main Street. After careful review, I have instructed that site remain open for testing. I want to thank the Minister for Crown Services, Jeff Wharton. I want to thank the CEO for MPI for their willingness to cooperate, their collaboration. We know that we as citizens have been well served by MPI's collaboration in all of these things, and we thank them at this point in time for allowing that site on Main Street to remain open for the foreseeable future for the purpose of testing those who need and want to test. And in addition to that, a new pop-up site just opened last week in South Winnipeg on Pembina Highway, another site opening on St. Mary's, more changes to come, but that commitment is, of course, the same to make sure that testing is there when and where Manitobans need it. Thank you, and at this point in time, I will turn things over to Dr. Brent Roussin.
Thank you, Minister. Good afternoon. So our current 5-day test positivity rate is 0.45%. We have 16 new cases till 9:30 this morning over the weekend. That's including Saturday, Sunday, and up until this morning. So there's 4 cases in each of the regions: Southern Health, Interlake, Eastern, Prairie Mountain Health, and Winnipeg. So case investigations remain underway, and additional information will be provided should it be required. Many of these cases are due to travel or close contacts to known cases. There are 3 current hospitalizations, 2 of which are in intensive care. 74 active cases with 319 individuals are listed as recovered, and the number of deaths due to COVID-19 remains at 7. As far as testing goes, on Friday we had 1,393, 1,581 on Saturday, and 808 on Sunday. And that brings our total to 84,967. In addition to this, we're providing information on a potential exposure to COVID-19 that may have occurred from a case that visited the Sherwood grocery store in Gull Lake while symptomatic on July 19, 20, and 21. And so again, this underscores that importance of staying home when ill. We know that this virus is transmitted through close, prolonged contact, more so by people who are symptomatic. So we really stress that staying home when ill. So people who public health have identified as close contacts will be identified by public health and advised to self-isolate. Others who are, say, at these locations that we announce do not need to self-isolate, but they should self-monitor for symptoms closely. Visit manitoba.ca/COVID-19 to use the online screening tool. Or they could call Health Links 204-788-8200 or toll free at 1-888-315-9257. So Manitobans are continuing to be concerned with the recent increase in numbers. We had quite a stretch there with 0 cases, and we're seeing cases again emerge, and we knew we're not done with this virus. And so we need to continue the precautions that got us where we are now. And we're going to need to continue those moving forward. And so again, we reiterate staying home when you're ill. And again, businesses, families need to really start making plans for this fall, this respiratory virus season coming, because people staying home when they're ill, we know that's plenty of people when respiratory virus season comes. So people, businesses should have plans in place now for increased absenteeism during this coming season. Practice good hygiene. Physical distancing is very important. We're going to need to continue our efforts in that regard, and that's really that 2 meters, 6 feet away from others. And we see that this remains important. We know we have a number of our recent cases are linked to such things as funerals. And we know that this is where this virus can thrive in events like this. This is close, it's prolonged contact. The nature of such events make physical distancing quite difficult. And if we're not cautious, this is where we see this virus spread. If you're not able to maintain physical distancing, then certainly wearing an appropriate mask is important. But also if you're at an event that is getting crowded and physical distancing is not likely, it's an enclosed, crowded space, so you should consider leaving. This is where we're seeing transmission of the virus here and in other jurisdictions. And then again, we can't emphasize enough, stay home if you're ill, even if it's mild symptoms. So those that are at increased risk of severe outcomes need to be extra cautious. Those over 65, those with underlying medical conditions, those with immune compromise need to take extra caution against being in enclosed, crowded spaces, maintain that physical distancing whenever possible. And again, we can't say it enough to continue to have Manitobans be kind to each other. There's no place for stigma or discrimination against people who may have acquired this or been in contact with it. Aside from being inappropriate, this is, does not help our efforts against COVID. It actually interferes with public health efforts. So be kind to Manitobans. Don't make judgments. Listen to public health advice, to credible advice, and we'll continue to get through this together. But stigma is definitely our enemy here. So continue to follow credible advice, manitoba.ca/COVID-19 for up-to-date information. And we can open up for questions. Thanks.
Dr. Roussin, the test positivity rate is 0.45, and that is, I understand, a good rate. But 2 weeks ago, we were down to 1 active case. Now we're at 74. The fact that there are 74 active cases now is probably a concern to Manitobans who thought that they were, maybe had a chance of being done with the virus. Or what do you say to people who might be worried about the number of active cases and the fact that cases are being announced every day now?
Yeah, I think that's, we tried to articulate that we were not going to be done with this virus, that this virus is still there and we need to take these cautions. And we're still seeing cases, and we're going to continue to see cases. And coming this fall, we're going to see more and more cases. But Manitobans already know what we need to do to prevent the spread. It's possible that because of the low numbers, because of how difficult it was for those months with heavy restrictions, that we may have lost some of our focus and loosened up on some of the things that got us here. But we're going to have to live with this virus. We're not going to escape a pandemic here. We're going to see cases. We're going to see hospitalizations. But all of the things that got us here, that hand hygiene, the physical distancing, the avoiding crowded indoor spaces, is going to help us moving forward. We're going to need to keep that going on.
Is test positivity rate the key figure here and the key number that's going to guide policy in the future?
Well, it's a really important one, and it's certainly not the only one, because even now when we have a test positivity rate that's relatively low, much of that test positivity rate is related to some clusters. So even then, it's not representing a community-based transmission right now. So we take that into account. We take the number of non-epi-linked cases, those cases we can't link to case, cluster, or travel, and then also demands on our healthcare system. So that's we don't look at one thing, but certainly test positivity rate is an important one.
Dr. Roussin, when will Dynacare stop sending samples to Brampton for processing?
I believe they are in the process in the upcoming weeks to have that full capacity right here in Manitoba. I don't have a specific date on that as of yet.
It's supposed to be the 29th of July. That's Wednesday. Is that still?
Yeah, I don't have a up-to-date number. I haven't heard an update
I
from
can
them.
speak to that as well. We've been in regular communication with Dynacare, and as of this week, I believe they are targeting Wednesday to be able to fully initialize the laboratory equipment that they brought into jurisdiction previously. They were, of course, part of our testing apparatus, but sending those samples out of jurisdiction, I believe to Mississauga, where they have capacity. Brampton, right. And now that capacity is here in the province. 1,400 tests per day is the capacity that I hear that they will be able to do in their Dynacare lab as of Wednesday, and they have plans to flex beyond that as well.
We've heard reports out of Ontario about a large number of false positives in Brampton. Is there going to be is CADM going to be double checking the positives out of the Dynacare lab?
I don't think that's in the plans. We, if there's ever an indication that we need a test to confirm, then we certainly would do that. But each of these labs have a lot of quality control measures in them and have to meet very high standards.
Dr. Roussin, we're hearing reports that members of Hutterite colonies are able to cross the American border as essential workers. Can you confirm if that's the case and if there's any concern about transmission from travel over the Canada-US border?
So I don't know that specifically. That's dealt with through the Federal Quarantine Act, so I don't have any details on who's actually crossing from there. Certainly it's travel across the American border here is a concern because their incident rate is much higher. So people, whether they're required to self-isolate or not, should take caution. So if it's an essential work, then working, probably wearing a mask, very close monitoring of symptoms, avoiding high-risk scenarios like large indoor group events and things. So that would be my advice to anyone who's ever been exempt from any travel restriction. It doesn't mean that it's just business as usual. You should take many precautions.
And with 74 active cases now and cases climbing fairly rapidly in Alberta and Saskatchewan, how are we considering reinstating that 14-day self-isolation? Are we any closer to considering that?
Yeah, and so, all of these restrictions that we put on, they're always on the table, and so we are monitoring that situation very closely. And, we don't have any imminent plans to put that back in place right now, but I would say to Manitobans and people who are thinking about traveling to Manitoba is to be cautious with your plans. Because we're going to do what we need to protect the health of Manitobans, and so that may result in re-implementation of those restrictions. And so be cautious right now when booking travel, because we could re-implement those.
Of all the new cases that you had, the 16 over the weekend, how many were from clusters and how many were non-cluster cases, or that? Because I know you're trying to get away from saying from the Hutterites, but for people who are concerned that this is in Winnipeg, for example, it's important to know if it's an isolated cluster outside of the city.
Yeah, so the numbers that we have right now is that there was 7 that were related to a close contact to a case, whether that's a cluster or not, but they were known contact to a case. There was 5 that were travel related. And there is 1 right now that is that we will classify as non-epi-linked, and the rest are still under investigation.
And earlier today, the Winnipeg Airports Authority put out the press release about making masks mandatory at the airport. Are we any closer to that in the general public as well, or what are your thoughts on that becoming a reality at the airport?
Yeah, so I think our messaging is going to stay where we have been, is that the things like hand hygiene, physical distancing, avoiding indoor crowded places are by far the most important thing we can do right now. Masks can have a role when physical distancing just can't be achieved, and so we're going to continue to recommend that in those circumstances. I think that, again, as we move closer to respiratory virus season, masks are probably going to become more and more part of our dialogue, and getting Manitobans used to wearing those in indoor environments. But as right now, we don't have any imminent plans to mandate. But just like any of our public health work, we'll do whatever we need to protect the health of Manitobans.
When you say more part of our dialogue, what do you mean about that? How do you see that being part of the dialogue? How do you see that messaging going without saying it's mandatory, but trying to get more people to wear masks?
Yeah, I think that's been our approach for the most part in Manitoba. A lot of the things that we've advised people to do were public health advice, and Manitobans stepped up to it. So we find that Manitobans, the majority of Manitobans, listen to public health advice. They do their part to reduce transmission, and so that's where we'll begin with masks. And if we find that transmission is continuing to occur, we find that masks may not be utilized as we would like, then that's an option to mandate.
Dr. Roussin, there are approximately 3,700 tests done in the last 3 days. Why so many? What's driving this number?
There's a couple things. One is that I think Manitobans have became more and more interested as we see the case numbers go, so people are paying more attention. We know that there's a number of cases of rhinovirus, the common cold, and so there's a lot of people who are having cold-like symptoms right now due to the rhinovirus, and so this is kind of that precursor to the fall, when we're going to see a lot of these type of viruses spreading around, and we don't really have a way to tell the difference just based on symptoms.
So there's a cold virus going around, and so people are concerned and
Getting tested is, exactly what we want. So people are staying home when they're ill, they're getting tested, and it's exactly what public health is advising.
Dr. Roussin, there's a 3-day exposure at the Sherwood Grocery there at Stead that you've mentioned here. Is it correct to assume then we're talking about a store employee? No one's going for popping cigarettes every day?
No, I'm not disclosing anything more. I don't know if I even have that information, but those are the dates that the public needs to be aware of. Yeah.
And just getting back to testing, Cadam's got a 1,000 comfortable daily testing capacity. Dynacare's going to 1,400. That's 2,400. You've got 8 of the Cepheid Gene Expert machines that can do a couple of tests a day. At most, we're looking at a 2,500 capacity here. When and how do we get to the 3,000 you guys talked about on April 28th?
Well, I'll go first and say that, remember that Dynacare's plan was always to bring more than 1,400, so they feel confident about their ability to reach 2,000 tests by the end of the summer. It was part of their commitment to Manitoba, and I'll let Brent speak to it as well, but Cadam also can flex beyond 1,000 as well. So we feel quite bullish about the capacity that we have built until this time in Manitoba, and the capacity that we will continue to need into the future.
Mm-hmm. Yeah, I don't have much more to add. I think that if we can get to that 3,000 capacity anyways by the end of summer or early fall, I think we're in a very good spot for our capacity.
Thank you. We're going to take a couple of questions from the phone now. From CTV Winnipeg, Jeff.
Well, hi, Dr. Roussin. Jeff Keel, CTV. As we're reopening, we're seeing more and more, organizations, public or private, start to either recommend or mandate, people wear masks. The airport is moving Wednesday, for example. You have to wear a mask now if you're in the terminal. We know Transit's recommending it as they ramp up service. I think it's August 2nd. Is this something to be expected now that we're reopening? And, of course, we have the travel restrictions lifted out west and maybe one day from the east.
Yeah, so I think that the continuum of masks is going to, carry on with the more and more recommendations for mask use. A lot of this is based on other jurisdictions where they had been seeing a lot of community-based transmission, and so the only other intervention in those places are masks, and so we see a lot of jurisdictions that are much more stringent on their mask use, and then it's to be expected that other jurisdictions would follow suit over time. So we're, at this point right now, we're still recommending masks when physical distancing can't be achieved. We're making it clear that masks are just an added potential benefit. The masks can't be relied on. We still need those other precautions that we've always been talking about. But yeah, as we move into fall, especially, we're going to see more and more recommendations regarding mask use.
Thank you for that. And my follow-up is for the minister. I know Dr. Roussin already touched on this, but with the overwhelming response you got to phase 4 on the dropping the 14-day quarantine period from Eastern Canada, I mean, is there any thought to reinstating the one for the rest of the country, just because a lot of these cases we're seeing now are travel related, and there's a lot of people out there questioning why we have dropped the quarantine period for the rest of the country.
Right. So, we've always said that we put these draft documents forward in order for them to have comment back from Manitobans, for Manitobans to have their say. Clearly, in this case, there wasn't a comfort level by Manitobans to open the East, but similarly, I would say to you, we continue to monitor the conditions. If we see a significant deterioration happening in, Western Canada, we've never said that we wouldn't reinstate those 14-day isolation requirements. At this point in time, we continue to monitor, and as we go forward, and we'll do the same when it comes to the other parts of those phased implementation plans.
From City News, Jonas.
Good afternoon, gentlemen. When it comes to planning for school reopening versus rising numbers, we know it's going to give or take a month to kind of handle where we're at now. So as we do get, that deadline for school is getting pretty close. How is that balance right now too being managed?
Well, I'll say first that, of course, there's a lot of families who are looking for more information about what the fall will hold for their families, for the children, and in what manner, shape, and form children will be returning to classrooms. I believe, if I'm not signaling too strongly, there's an update coming later this week. I believe that Brent Roussin and the Minister of Education will be back here to provide an update of their thinking. So I'm going to ask you to hold tight for another few days, but I know that Manitobans are seeking those clarifications, and we will be providing those clarifications.
And just to follow up on that, would that guide the self-isolation policies that you guys are looking at perhaps in the state?
Can you just repeat that? I didn't hear the question.
Apologies there. Yes. So would this help shape the reinstatement policy on self-isolation from outside of Manitoba to Western Canada, the fact that, we are seeing rising numbers and school is right around the corner?
Oh, you're talking about the link between schools and then requirements on our 14-day isolation. I don't think you can make a direct link there. Like, we're looking at many metrics when we're looking at the situation, some ameliorating, some deteriorating, and then, Dr. Roussin has always said it's on the basis of a lot of public health evidence. It's on the basis of our continued interaction with the federal government, with our counterparts in provinces and territories, with the Public Health Agency of Canada, with experts in our own jurisdiction, that we are making determinations about what is best for Manitoba.
From the Brandon Sun, Colin.
Hi there, gentlemen. I was just wondering, with the resumption of Major League Baseball in the United States and some COVID cases arising from teams traveling, does that give you any pause for having Winnipeg be the site of a CFL hub, or having junior hockey resume sometime later in the year?
So I'll repeat what I said last week at the press availability on Thursday, and then Brent may want to add. But when it comes to this CFL hub, that is for Winnipeg. We've got a great deal of confidence. I know that this plan of theirs has the confidence of public health. The total isolation period that is contemplated is actually 14 days plus another 7 days, 14 days before coming to Manitoba, and then 7 days here. There are hotels that are dedicated to use by those teams. No other travelers can stay in those hotels, so that creates a bubble. The strict enforcement of that bubble to make sure that there isn't interaction between members of the public and those players, managers, coaches, therapists, and all the people that go along with that team. No fans in the stands, no travelers coming here from other jurisdictions for those games, and strict enforcement of violations of the bubble. So if you take the situation that's now being seen in baseball, and if you had a player here that was, tested positive, then they would self-isolate here, and then they would be required to remain in their place. There would be the same kind of public health investigation. There would be the same kind of process, the same kind of monitoring as that individual. So this plan is a very strong one and one that we believe meets the test. Brent, anything to add on that?
No, I think that sums it up. In the U.S. right now, where the incidence rate in those jurisdictions is much greater than what we have here. The way they have those leagues set up is there's still travel involved from many jurisdictions, so it's not analogous to the bubble we have set up here.
No follow-up question. Thank you.
From CJOB, Diana.
Good afternoon, Diana from 680 CJOB. Dr. Roussin, just wondering if the province has registered any positive tests from the sentinel surveillance you've been doing. How is that working so far?
Yeah, so it's a good question. So, we really haven't picked up any cases from there. I don't want to say zero. Certainly, the recent cases that we have, they are related to cases, to clusters, to travel. So that we're not getting, many, and certainly recently we haven't had any of these asymptomatic clients that have just tested as far as Sentinel goes. So we're seeing most of these cases here are related to travel, to known contact cases.
And just as a follow-up, you kind of touched on this earlier. Obviously, we are proceeding with reopening, albeit not everything that the province had planned. The cases are increasing. How do we get people to take this seriously? It seems like some may have let their guard down a bit.
I think it's just, getting back to what has got us here. That, I think we didn't want to see any cases, and so it was good to see that stretch, but I think it's being human. I think that made a lot of people rest easy, that maybe we were done with the virus, and so these new numbers are, reaffirming that we're not done with this virus, that we need to live with this virus. If we want to keep our economy going, then we have to do the things that got us here. So we have to still maintain that physical distancing when we're out. We have to avoid crowding, and that close, prolonged contact is what spreads this virus.
Thank you.
From CBC Radio Canada, Mohammed.
Hello, Dr. Roussin. It's Mohammed from CBC Radio Canada. It may be a little bit early, but do you have any plans to begin PCR tests in Canada in the month?
Oh, sorry, I didn't catch that. When you meant something about a PCR test?
Yeah, I said, do you have any plans to begin the PCR tests in Manitoba?
Oh, PCR tests. So all of the tests we do for COVID here are at the lab are PCR tests. So I'm not sure. Maybe was that what you were referring to?
Oh, sorry, I was talking about serological tests.
Oh, serological tests. Yeah. So we do have plans on doing that. Again, this is going to be a seroprevalence study. So it's not about testing individuals and letting them know that they have antibodies. It's about running the test on samples already received in a somewhat random way to give us a sense on just how many Manitobans were infected during this wave. And so we don't have any results on that. I'm not sure if it's actually commenced yet, but it is in the works to start.
And I have no follow-up.
Thank you. We now return to room 68 for some final questions.
Dr. Roussin, what protocols do you envision for mask use this fall? You made a couple of references to perhaps, we might be in a position where the province will be recommending or issuing orders with regards to masks. What are some of the things you envision?
Yeah, what I would foresee is when respiratory virus season comes is it's very likely that we'll be recommending that Manitobans wear masks in public indoor places. And that's likely what our recommendation will be.
And that would begin like whenever you see flu season beginning, or,
Yeah,
or a specific date in mind? Or?
No specific date, and it certainly we'll look at our numbers. If we see a lot of community-based transmission sooner, then it might be something we go to sooner. But I envision that knowing what we know in respiratory virus season, there's going to be a lot of respiratory illness, just like there is every year, and so masks is our next intervention.
Mr. Friesen, you've talked a lot about testing numbers and capacity currently that we're getting up to. When we hit the fall, do you know what we will need for capacity to handle that load, especially with the onslaught of flu season?
Well, I mean, it's difficult to know exactly what we will need, but we just heard Dr. Roussin say that he feels comfortable that if we can get to 3,000 tests a day, that's going to be some very robust capacity for a jurisdiction our size to stay on top of things.
Dr. Roussin, sounds like you've been doing some projections. What do you think daily active case counts are going to look like in September and October?
Yeah, it's tough to know. We're going to see a lot of respiratory illness. That's what we know, because we see that every year. But daily counts, I wouldn't speculate to that. That wouldn't be based on on science right now to speculate.
Fair enough. Mohammed asked about the seroprevalence study. The other thing we keep asking about is, when are we going to start seeing that contact tracing yet?
Well, the app is at the national level that they're working on now, and I think they're still ironing out some of the details with many of the regions. So I think it's likely to be useful, but it's never going to replace the need for public health doing full contact tracing on cases.
Dr. Roussin, just going back to my previous question on the possibility of members of Hutterite colonies crossing the Canada-US border, just through contact tracing investigations, are you able to confirm if any of the recent cases do involve travel over the US border?
Well, I wouldn't speak specifically to any groups like that. We do have cases that are related to travel to the U.S. Those aren't actually related to a cluster, though. So.
When you guys were talking about travel restrictions to Eastern Canada and bringing them in, and you guys obviously decided not to do that, did you actually consider eliminating or bringing those travel restrictions back for Alberta and Western Canada? You guys say you're going to continue to monitor it, but was it on the table to put those restrictions back in place?
It wasn't specifically on the table, but this is something that we're always monitoring and thinking about.
Last one.
Dr. Roussin, we're hearing concerns from some people who have loved ones in personal care homes. I know Phase 4 eased the restrictions slightly, but they're just saying it's taking a toll on their mom and dad's mental health, and they just need to be able to get out of the building, whether it's going for a drive or going to a park. Is that something that you would look at, and could that be done in a safe manner?
There are some things in the guidelines that are coming out regarding these social passes, and so it's important to note that these are all, really important things, right? We always say there's more to health than just this virus. Manitoba's success is largely due to the part that we were able to keep this virus out of those personal care homes. And so when we loosen these restrictions, we're not saying that it's without risk. Right? So when we had one person visiting, there's some risk involved in that. When you expand it, there's more risk involved. These are calculated balances. And so going out on passes, again, we're working on that. It doesn't mean it's risk-free. All right? So we all are accepting a certain level of risk to balance out the other health impacts of this. So it's just clear that when we do these things, it's not without risk. It's something that we've decided that is worth that risk.
Thank you. Thanks, everyone.